Hi, I'm Dr. Ralph Tufano. I'm an ATA board member and an otolaryngologist head and neck surgeon who only performs surgery for thyroid and parathyroid disease. I wanted to take a moment of your time to discuss the impact of COVID-19 on surgeons and how it has affected the way we deliver care to our patients. In March of this year, most of us were told that the COVID-19 pandemic was upon us and that we needed to stop doing elective surgical cases. The rationale was to preserve PPE and prevent unnecessary exposure to our patients and healthcare providers. The term elective was left subject to interpretation by surgeons and patients. Certainly most benign thyroid and parathyroid disease conditions recommended for surgery could be considered elective and deferred. Most large thyroid cancers and those demonstrating aggressive behavior or posing an imminent threat were permitted to go forward. Our professional medical societies, including the AHNS, AAES, SSO, and the ATA Surgical Affairs Committee, all provided us with guidance and support to help make these decisions. But that did not make it any easier for us or our patients when we had to tell them they needed to wait for surgical care they were seeking. This fear of the unknown manifested in many questions like, when do you think I will have my surgery? Is it safe to wait that long? And doesn't medullary thyroid cancer behave differently than papillary thyroid cancer? Just to list a few. Many patients understood the rationale for the deferral of their surgery, but acknowledged that it was just more stress added on to what the COVID-19 pandemic had already caused. We as surgeons tried to allay their fears while sharing our stress and anxiety about the same issues. On that, we could stand united and on common ground. Our teams assiduously canceled all elective cases and compiled a list of those cases that were deferred so that once we could begin elective surgeries, we would be able to safely and expeditiously deliver the surgical care they were hopeful for. Now, as states begin to open up and elective surgeries are permitted, we are yet again asked to make some difficult decisions by prioritizing our backlog of cases. When my state's governor first announced that elective surgeries were permitted again, we received a large volume of phone calls from our patients requesting an update about when their surgery would be. This was now a new and additional stress as we had to explain that the ramp up would be a gradual process. We still had concerns about PPE, the accuracy of now routine COVID testing results for patients prior to surgery, and the possible exposure of our patients to COVID-19 in our healthcare facilities. Our professional medical societies have stepped up yet again to help provide guidance with regard to variables we should consider when prioritizing cases. While we start working through this backlog of cases, we must always remember to keep safety and quality as the guiding principles in the care that we provide. This has been an arduous effort for all of us, patients, surgeons, and care teams, and we are sure to experience many unforeseen challenges in the future as we all navigate this uncharted territory together. However, embracing the qualities of collegiality, collaboration, empathy, flexibility, and patience will help us all to overcome these challenges and again deliver the superb care we have become known for in an innovative and a compassionate way. In the end, I think we will all be stronger together. Thank you.